is 1 block, 2 balls, either Yoga Tune-Up Therapy Plus balls or 2 tennis balls will do the trick. Tennis balls are a little bit better than lacrosse balls just because of the area that we're going to be releasing. Having something softer with a little bit more give is nice. The Therapy Plus balls are ideal because they're designed for self-myofascial release or self-massage. Tennis balls are made to play tennis, but they'll do the trick in a pinch. If you don't have a block, you can also use a rolled up towel, a bolster, something else that will just give you a little bit of height. I'm going to show you here on the spine the areas that we're going to be releasing. So this is the spine here. When we get down and do the release work, the areas that we're going to be releasing are going to be around the back of the pelvis. This area here is called your PSIS. Really down here truly is the PSIS. And we're going to be releasing somewhere around there. So you'll feel this area, you'll feel these bony ridges, and you can be somewhere on the outside or somewhere on the inside. Around here, this area is your SI joint, your sacroiliac joint. This is an area for a lot of people that can either be really stiff or a bit too mobile. So listen to how all of this feels. Sometimes the release work feels good, sometimes it doesn't. But you'll start somewhere around the area around PSIS. We'll start with 1 ball on each side, but it'll fit somewhere in here, 1 on each side. From there, we'll move out a little bit into the flesh of your glutes. This is where your glute max and all of your other glute muscles are. So you have glute max, glute med, glute min, some other deeper muscles within there. We're gonna just kind of focus on the area very generally. So somewhere around the flesh of your glutes. From there, we'll move back to the PSIS and go above it. So now you're along the iliac crest. And from there, again, exploring that area, seeing how it feels. Then you'll move in closer to the spine. Again, we'll have 1 on each side, so we're balancing, and then we'll move up to the area. This model doesn't have ribs, but you'll move up. This area here is your 12th rib. You're gonna move up to the area around your 12th rib. So there's this few inches, a couple ball movements up your spine to your 12th rib. You'll feel that as a bony point. You can even feel on your own body where that is. Feeling especially around to the back, our ribs are a little bit lower on the side, a little bit higher in back, and you'll take and place the ball somewhere around there and then move down in the middle of your body. So what that looks like on me, those areas, again, I'll show you here just because when I'm laying down, you won't see it quite as well. We'll be at the PSIS, so I can find those bony points here, starting somewhere around there, then moving out into the flesh of the glutes, coming back to the PSIS, going up along iliac crest, coming back to the center along your spine, not right on the spine, but just off to the side, getting to the 12th rib, moving out, and coming back down.